All right, guys, welcome back to my Sunday live series. So, this is our space to talk about all things running, rehab, and hips. Today, I'm really excited to bring on Lindsey of Laurel Running Labs and talk to her about her story with hip dysplasia and labral tear and how she has returned to running without any surgery. So, let me go ahead and make sure she's added. I'll invite her. All right. Hi, Lindsey.
Hi, how are you?
I'm good. How are you?
Good, thank you. Thanks for having me.
Thanks so much for coming on. How's your Sunday been so far?
Not bad. Just another Sunday in the Mile High City. It starts off, very chilly these days
Yeah.
and
Yeah,
gradually warms up. So it's been good. How are you?
that's awesome. I am good. I'm actually living on Kauai right now, which is not my norm. I'm here for about 3 months, so it's so different than my Seattle winter. It's like sunny and warm, and the beach is right there. It's crazy.
Oh, I'm incredibly jealous. We're actually heading to Maui in a couple weeks, so I'm really excited to have a change of pace from this winter weather that we get.
Yes, yeah, the islands out here are so beautiful, so I'm excited for you. To start today, tell us a little bit about yourself, who you are, your run history, your hip history, kind of how you became a run coach. Give us a little bit of the rundown.
Sure. So, like I said, I live here in Denver, Colorado. I've lived here for about 18 years. I'm originally from the Northeast. I grew up in Connecticut. Um, I have two kids. Life is busy. I have a career. I'm an avid runner, like you mentioned. I just really fell in love with long distance, particularly the marathon distance.
Mhm.
Um, and then, like you said, I'm also a certified run coach.
Yes.
Um, Growing up, I was a competitive figure skater. So
Cool.
I really lived and breathed that um, just athletic background of, pushing yourself physically. And that's just really all I knew. And running really helped fill that void when I had stopped
Yes.
skating.
Mhm.
So I got into running probably over a decade ago after my son was born.
Mhm.
And um, I just never looked back. And then, through all of that, I had dealt with chronic hip pain.
Mhm.
And I was just over the years consistently being misdiagnosed, going
Mhm.
to PT, kind of going through the motions of PT, stopping PT, and the cycle would start over. And then
Mhm.
last August, I was finally diagnosed with hip dysplasia and a labral tear. And it was from there that I was really able to do the research, see all the right people, figure out what I needed to do. And, um, it's been over a year. And so far, I've been able to avoid that really invasive surgery that I was supposed to have.
Mhm.
And, you know, I'm, I'm running stronger than I had ever been in the past.
That is so crazy. That is so crazy. Um, that is just wild. I Tell me a little bit more about like your experiences with going to PT when you were um I don't know, like in the past, where you just
Mm-hmm.
kind of go through the cycle. Like, were they not referring to imaging, or did you? Yeah, like how was it? Just kind of coming in and out of it.
Sure. So this is going back quite a while at this point, probably um, pre-COVID and then some.
Yeah,
So I would go to PT and I would go in with hip pain.
yeah.
Um, and because now that I know all of this, I have a very flexible hip joint.
Yep.
Um, the typical tests that they would do for labral tear wouldn't present itself like a labral
Yes.
tear.
Yep.
And I was never having pain from my hip joint
Yep.
because I also had all of these other ailments from compromising how the structure of my hip was positioned. So I
Mhm.
had bursitis and I had, you know, tendinosis, which is chronic tendinitis of like the glute tendons, just
Yes.
all of the little tendons that hold the hip joint together. Like I was just having pain where I couldn't really identify where it was coming from because it was just
Yeah.
all over. So I would go to PT. I would get, the standard exercises, the strengthening exercises, but there was just so much inflammation in there that I think I was just never able to get over and, really stop that cycle, if that makes sense.
Yes, for sure. Yeah, I have seen this. This is like the number one reason why I went into this was I kept seeing these women like ages probably like 20 whatever, 20 something to 50 coming in with like unrelenting hip pain, and they're like I can't get any answers. They maybe have tried PT and I was like a second resort as to like where I was. Maybe they've already been to multiple medical doctors. Maybe they've been to like even probably not surgeons at this point, but yeah, they just kept going through the normal provocative tests, and it wasn't
Mm-hmm.
being the symptoms weren't being reproduced,
Mm-hmm.
or they weren't diagnosed with the typical labral tear or impingement or whatever. And the symptomology of like the young kind of 20 to 50-year-old like female athlete is just different than that of like a 60-year-old man or whatever. And I was like, this is the sector of women that needs specialized care because they're gonna push through pain for sure.
Mm-hmm.
And yeah, they need someone that's like looking out for them. So that makes so much sense to me that it was kind of overlooked.
Yeah. So I think what I forgot to mention was I did go to my primary care physician. So that's kind of how I got, the referral to go into PT.
Okay.
But what I was going in for, I initially would have debilitating pain, like
Yeah.
radiating pain down my leg, and
Yes.
I could hardly walk, and it was just um, being misdiagnosed as like sciatica,
Yes.
overuse, things
Yeah.
like that. So I would get, and everyone is different, and I would get these steroid packs, and I would take those, and it would get to a comfortable level.
Yeah.
And like you said, I would just continue to run because I didn't think there was any underlying condition.
Yeah.
So this is the cycle that was going on for years. And I had an x-ray done because that was like the first imaging
Yes.
step. And the x-ray came back normal. There was no stress fracture. At that point, they didn't even pick up on the hip dysplasia.
Yeah.
So fast forward 2 years, I finally got an MRI in August of 2021. And that's when I was diagnosed with the hip dysplasia and the labral tear.
Yeah. Yeah, and that is pretty common with the x-ray that sometimes it won't pick up dysplasia. Just imaging is hard, and I don't know. It's not uncommon. How did you get the push for the MRI? Was it like a doctor that said, "Okay, it's time," or was it you that was like, "Okay, I need more."
So at that point, I had been just at my primary care physician for an annual checkup. And, I had been going back for my hip issue in the past. And, the topic just came up and she was like, "Are you still having issues?" I was like, "Yes, I am, but it's a lot more manageable than it was,"
Hmm.
which was the truth. And it wasn't until that point where, "Oh, it's been 2 years. I think we can finally get you an MRI." And
Yeah.
that's when I decided to just go through with the imaging and see what it was.
Hmm.
And it was a lot worse than I thought it was going to be.
Yeah, yes, yes, unfortunately. And I will say, like, if you are working with a PT at that time and you enjoy your PT, really pushing to ask them like, if they're also on the same page with you, pushing to ask them to ask your doctor for an MRI is always a good step. If they think that it's warranted, like, I have definitely pushed for a couple images where I was like, I think this person really needs it.
Mm-hmm.
And I've also been like, I think you're fine to not get it too. So that's a good place to advocate for yourself.
Yeah, I agree. And I guess I just didn't really know what the process was, and I
Oh, yeah.
was feeling better, and I honestly didn't know, and I was just thinking I was doing good going to PT, but looking back on it, do I wish I do I do I wish I knew what I have? Like, I think knowing what I have kind of does me a disservice sometimes.
Yes. Yeah.
But at the same time, I was able to um, do a lot of research specifically about my condition. I was able to see specialists. I saw 7 hip surgeons in the state of Colorado that were either specialized in reconstruction, labral tear, or the PAO surgery that,
Yeah.
I would have had to have because no one would fix my labral tear without
Yeah.
fixing the structure of my hip joint.
Right. Because you have the dysplasia. Wow, that is
Yeah.
wild.
Yeah.
Um, after you had the diagnosis of your MRI, with the dysplasia labral tear, what has your journey been since then? So you saw these surgeons. Um, what was that like? And then kind of how are you where you are now?
Yeah, no, that's a great question. So, all of this started, like I said, back in August of 2021. And at this point I've been running, like I'm running. I have hip pain, but it's just kind of like this is just me and running. I have hip pain. I can do this. But I saw an ortho surgeon who I see. I don't want to say I see him regularly, but I had 2 injections. I had 2 cortisone shots, one into my hip joint and one into the like bursitis area,
Yeah.
tendinosis and inflammation. And that significantly helped. It was almost like trial and error to see like where the pain
Yeah.
was coming from. So I felt relief with the injection into the bursitis and glute tendon area.
Mhm.
So from there, I just knew that the pain wasn't coming from my joint, which, if that's where the labral tear would present pain, there's there's it's really hard I think, to avoid surgery at that point if the
Mhm.
pain is coming from the labral. I mean, you would know better, but
Yeah, it's so different for everyone.
yeah,
This is literally how it is for everyone. It's like, okay, like this and then this and then this. It's never just this like clear shot line. So
yeah, no,
this is highlighting how it is for all these women.
I'm sure. So, um, once I went to that ortho surgeon, he wasn't a hip specialist. So then I went to someone that was specialized with labral tear. And I kept getting the same thing, like, we can't fix your labral tear unless you have this huge underlying surgery called a PAO.
Yeah.
So there's a few PAO specific surgeons here in Colorado, and lucky enough for me, they are some of the world-class surgeons that do this surgery, and they are world renowned. Like, people fly in from all over to get this surgery done by them.
Oh my gosh.
Um, and it was kind of mixed reviews, like maybe you would benefit from it, maybe you wouldn't. Like, your dysplasia, I got on a spectrum like mild to moderate. And then I saw one surgeon, he was like, if you were my family member, I would tell you not to do this. And I
I
was
love
like,
that.
okay, that's all I
Yes.
needed to hear.
Yes. That is so good. I think that maybe it's this trick that we learned along the way. I don't know, but when I really connect with the patient and I see like something in them, I'm like, if you were my mom or if you were my sister, I would tell you not to do this. That's amazing.
So that just really stuck with me. And I was just determined to find a way to continue running. And at that point, I didn't think that that was going to be possible for me. I was 6 months out from running in um, the Boston Marathon. Sorry, I still get really emotional talking about this.
Oh my gosh. It's okay.
Uh, but this process just really told me that, you have to trust your instincts, and rushing into something as great as a surgery that is reconstructing your entire pelvis to position it over your hip joint, who's to say that that would have worked for me? I would
Yeah.
still have a 60% chance of needing a total hip replacement. So I was just determined to do everything possible to avoid it.
Yes. So good. That's amazing. I think I think too, with the decision to not get surgery, and also I'm not either pro or against surgery. I'm pro patient. I don't care what people want. It's so personal, but the emotion that you just had, like, that is what you need to get through this, because it is like, it is kind of an everyday thing where you have to like plan, especially if you're a runner, you have to plan, how can I run the most comfortably this week? Like, what can I do for myself to run the most comfortably, and to set myself up for success so I don't get stuck in that pain cycle.
Mm-hmm.
So yeah, I'm inspired by your just like courageousness and like grit to get through this.
I thank you. I have a running coach myself, and if you were to ask her about this process, I'm sure she would say that I have a very non-traditional training plan at this point.
Yes.
And I have to be very mindful of my body.
Yes.
I know my limits,
Yeah.
and I can sense when I have a flare up coming on. And I supplement running with cross training a lot. And I really learned how to utilize cross training in my own training. So it allows me to not have impact of very high mileage consistently.
Yeah.
And that is to say, I was able to get up to my highest volume ever in my
Yay.
last marathon build up, but I
That's
used cross training very early on in my plan to build upon, and then I
yeah,
converted them into runs.
it's amazing. That is awesome. Um, how, yeah, how is running looking for you now? Where, what races have you done, or what's your training looking like, now?
Yeah, so like I said, I was able to finish the Boston Marathon in April.
Amazing.
It was a tough day for me, but I got there, which I didn't think I was going to be able to get there. And then was able to maintain my fitness through the summer. I tried some new things. I learned how to swim, which I'm like a horrendous swimmer.
Humbling.
I embraced the uncomfortableness of trying something new. I finished a triathlon, which,
Oh my God.
again, if you were to ask my friends how that went, they probably wouldn't say it was
Oh my
that
gosh.
great, but I did it. And then I had the best marathon build ever for this past fall marathon that I did, and I ran almost a 10-minute PR. So I just I'm just so grateful that I
It's crazy.
trusted myself and I didn't rush
Yes.
into that surgery. And I saw all the specialists, even though the process was horrible and
Yeah.
expensive and
Yeah.
draining. So
Yeah. Yeah, you totally know yourself the best. You totally, totally know. And yeah, it's just amazing to get all the, or it's important to get all the information and build that. But at the end of the day, it's like whatever you feel like in your gut, I think is the right thing to do, because that's the thing that you're going to be, um, like, the most confident in at the end of the day.
yeah, I couldn't agree with you more. And I know everyone's situation is different, and there are just so many variables and so many extremes in your condition. But if you just trust yourself, like like you said, you know yourself the best. And I've learned so much from this process. And I really truly think if something is meaningful enough to you, you'll find a way to do
I think so too. I think so too. Um, Are you, or in this process, since you've had the MRI and diagnosis, we'll say, have you been seeing a PT, or are you just working with your run coach? What is that looking like for you?
Yeah, so I have doubled down on PT. I go literally once a week, and I found a PT that is really, really great, and she gets my situation.
Yeah,
We found that active release therapy and needling is like the number one things for me. I have issues with my psoas and you'll know these terms better than I do, but
yeah,
like hip flexor area,
yeah,
TFL, all of that.
yeah,
As they get tight, they tend to rub more against my whether it's labral tear or a hip joint or whatever it is.
yeah, yeah,
So keeping those in good form has been most important for me.
yeah,
And I feel I haven't been to PT in 2 weeks because of some personal stuff that I have, but I feel it. Like I need to go there and I
yeah,
need I need PT.
yes. For sure. Yeah, that's really common with labral tears is and hip dysplasia especially. You're just so much more mobile through the hip joint that those muscles like reactively tighten up, especially with
Hmm.
your when you're running a lot. So having ways, whether it's PT, like going in person or exercises, or maybe a massage therapist or someone that you see that can like walk you through how to get out of that muscle guarding pattern is that's so valuable. So valuable.
Yeah, that's been so helpful. And um, in addition to PT, I had seen a um, running technique specialist
Oh,
that's located here in Denver. Um, and I overhauled my running gait. And I think that that's been really helpful. I mean, that was definitely a process in itself, basically learning how to run differently.
yeah,
Um, so those two things, I'm consistently strength training. Not only am I doing hip specific exercises, but just overall strengthening has
yeah.
been a game changer also.
My gosh, all of those things are perfect. You're just hitting, you're hitting it spot on. So great. Yeah, I think with the, uh, with hip dysplasia labels here, you don't want to overload. Obviously, you don't want to run too much. So I feel like that strength training really fills an amazing gap of just having like the ability to get stronger and progress. Um,
Hmm.
And I also feel like the running analysis for women with hip dysplasia is actually invaluable because women with hip dysplasia like tend to fall a little bit differently on the affected side. You're just a little bit less like strong and robust. So
Hmm.
having that piece, I actually would advocate for that for women with hip dysplasia.
Yeah, that was incredibly helpful. But I mean, I'm hypersensitive to it, and even looking at my own, if I were to watch myself running, I can see the hip dysplasia on my
Yeah.
right side.
Yeah.
It's very noticeable for me, and
Yeah.
even people on Instagram have pointed that out to me as well. I'm like, oh, thank you.
Thank you. Oh my gosh. You know what? I used to be so insecure and then I went for a run and I was looking at all these people and I'm a PT, so that's what I do. And I was like, no one out here is running with perfect form. No one is. It's just part of it.
Yeah, it really is. I agree.
Well, I think you're doing all of the right things. Um, and it's such a journey, but I think you're honestly crushing it and I'm so excited that you were able to do this without having to go through that major PAO.
Yeah, no, I'm very grateful every day, and um, I know it's a really tough surgery and it's a really tough road. So I know people that have had that done, and I'm in awe of them. It's a tough one.
Yeah. Yeah. Is there anything else that you want to say about running or your hip story or just anything in general on that note?
No, I think this was a great conversation, and I appreciate you allowing me to come on here and share my story because I know there are a lot of people out there that have hip pain, and I even coach several, over the years, I've had athletes
Yeah.
with hip pain as well. And, for me, just being able to identify with that and understand and really be able to modify, I think is helpful. And I do it in my own training and it's worked for me. And like I said, everyone is different, but it's really important to understand the root of your issue and do all the
Yes.
research.
Yes. You're so right. For your coaching, what services do you provide? How does that work if I want to work with you or anyone wants to work with you?
Sure. So I am a run coach with the coaching group Run to the Finish. It's headed up by Amanda Brooks, and there are 10 of us coaches. We work with all athletes, all paces, all ages, people just starting out, people looking to BQ, people looking to run, world major marathons. It's just a really great coaching group, tons of resources. We have strength training, running education.
Awesome.
Yeah, so there is a link in my bio to the one-on-one coaching. But again, I'm also just really proud to be part of that coaching group, and it's been really great.
That's awesome. Yeah, I'll invite you as a collaborator and then your link or your profile will be highlighted and then people can just click on your link and then check out more about that. I think my last question is if I was a woman with hip pain and I signed up with you as a run coach, what kind of things would you give me outside of running to be able to cross train so I don't have to have as much impact into my hip? What does that look
Yeah, that's a really great question. I mean, it is um, really helpful to identify, what works and what doesn't. So a lot of it
like?
is, kind of trial and error and supplementing, but I've always found cycling.
Yeah.
That's what I do myself to supplement. I think that's a great exercise with very little to no impact that builds incredible endurance base.
Yes.
Swimming, if you like to do that, is another great exercise. But also, working with a PT if that's something that the athlete has, but, hip specific exercises, consistently on the schedule as well, in addition to, the full body train program is helpful.
Amazing. Amazing. Oh my gosh. I will keep you in my back pocket for when I need to refer people out. Oh my gosh. Well, thank you so much, Lindsay, for coming on. I appreciate it. I feel like I learn new things every time I talk to someone that has gone through this. So I really appreciate that.
Well, thank you so much. I had a great time chatting with you. It's been fun.
Yes. Are you training for anything now?
Yes, right now I am currently training for a half marathon in February, and I'm going to be running the London Marathon in April. So
Oh
I'll
my
be starting training
gosh.
for that fairly soon also.
That is amazing. Well, good luck with your training cycles, and I will keep an eye out for all your stuff on Instagram.
Thank you so much. It was good to talk to you.
Good to talk to you too. Bye.
Bye.